you. Well, this morning on today's Health, oh, my aching feet. With holiday parties in full swing, millions of women are digging into their closets for their most fashionable heels, but at the expense of physical comfort. So how do you protect your feet from paying the price for your style choices? Dr. Keri Peterson is an internist and contributor to Women's Health magazine. Dr. Peterson, good morning.
Good morning, Natalie.
So we know they hurt, but we love the way they look. But why exactly, when you look at the foot anatomically, why do they hurt your feet?
They put so much pressure on the ball of the foot. Just a 1-inch heel is going to increase the pressure by 22%, a 2-inch heel by 57%, and a 3-inch heel by a whopping 76% more pressure on the front.
So those triple platforms that we're seeing, I'm guessing, triple all of that.
Tremendous pressure. Not to mention that angle that your foot's at creates a lot of tension in the calf. The calf gets tight, and then when you try to wear flats, it puts a lot of tension on the calf, and it can be painful.
Are some heels, though, kinder to your feet than others? For example, wedges, or, you know, if you do have some of that platform, if you have a little bit in the front as well to sort of even out the back, does that make it better?
Take a little bit, but it still does have an incline, so it still does create pressure with the toe box, with your toes.
Now, bunions are a very common foot ailment that a lot of women face. What exactly causes them? It's sort of that bulging bone look, right?
Yes, what it is, it's a displacement of the first joint of the foot such that the bone juts inward. And the most common cause is wearing a tight, pointy high heel. But there are some other causes. If you are born with certain foot shapes, then that can contribute to it, as well as arthritis or injuries.
So how can you treat bunions?
The first thing is proper shoe fit. You want a material that's stretchy, like a leather that can conform to the shape of your foot. Wearing a orthotic insole can take some of the pressure off that, and making sure that the shoe is wide enough to accommodate the widest part of the foot. That's the first step. The next would be an insole such as this that takes the pressure off. And if you're still having pain, as a last resort, surgery would be the next option.
All right. Okay. After bunions, hammer toe pain. A lot of people have that as well. I keep thinking of the movie Boomerang, where he looks at the bottom of the sheet. Hammer toe.
Yes. Hammer toes, as you can see in the picture, is a bent deformity of the joint of the toe. This is typically caused by a shoe that's too short, so it abuts against the tip, and it causes it to bend upward so that the toe does not lie flat, and it can cause quite a bit of pain in the joint itself.
Exactly. So what are some possible treatment options here?
One of them would be a splint such as this. This is tried as a first-line treatment conservatively. The toe is inserted into the strap, and it pulls it flat, and this pad goes under the foot. This does not have a high success rate, but it's worth trying.
Sort of forces your foot to stretch out?
It forces that joint to go flat for the toe to lie flat. The next thing would be, if you are having pain in the joint, to have a cortisone shot by a podiatrist. But really the best permanent cure is surgery.
Right. Okay. And then moving on to corns and calluses. What is the difference between the two?
Well, both of them are thickened dead layers of tissue that are caused by pressure or friction on the foot. But a corn is typically located between the toes, and it has this core to it that can be very sharp and painful, whereas a callus is on the side or the bottom of the foot and tends to be very flat.
Okay, and what possible treatments for those?
So first you want to soak your feet about twice a week in the shower to get them nice and soft, and then you take a pumice stone and you gently rub the corn or the callus until the skin turns a little pink, and then you can use a callus softening cream, which you can get just at the drugstore. But if that's not enough, you can get a medical pedicure where the podiatrist shaves them off. And you want to make sure you don't do this at the local nail salon because it may not be sterile equipment.
Yeah, no, definitely not when they're using the tools. Make sure you're getting the best of care. Okay, next is plantar fasciitis, and this is, again, very, very common foot problem. I know especially a lot of athletes who have this as well, but
very common.
Affects a lot of people.
What it is, to show you, demonstrate on the skeleton, is the plantar fascia is this band that goes from the heel to the toe, and it creates arch support. When it's inflamed, it becomes very painful, and it causes pain in the heel of the foot, especially in the morning when you first put your foot on the ground. And what causes this is if you have very high arches or flat feet, you don't have enough support, it can create this inflammation. Or if you're standing on your feet all day at work, or if you're overweight, that's going to cause this inflammation.
And just really quickly, because we're out of time, but treatments for that, really?
Treatment, conservatively, ice, stretching, and proper insoles. If that doesn't work, you can try ultrasound therapy, and if that does not work, surgery.
And ditch the heels after more than 4 hours, right?
Yes, that's correct.
Ditch the heels. All right, Dr. Keri Peterson, thank you so much.
Thanks, Natalie.
Coming up